days after the government assured that they will vaccinate all Indians by December this year, the centre's top lawyer, the Solicitor General Tushar Mehta, reiterated that statement before the Supreme Court. He has promised that the government can procure more vaccines and complete inoculation of all eligible adults by December or, in fact, even earlier. But the Supreme Court pointed out what it called various flaws in the government's vaccine strategy and has asked for a policy document. Now, to begin with, the Apex Court has pulled up the centre over vaccine procurement, saying that it cannot put the onus on states or municipal corporations and that they will be left in the lurch. The court has made it clear it is the Union Government of India that needs to procure vaccines for the entire country. This was one of the key observations. Now, the court has also questioned the issue of differential pricing of vaccines. The Apex Court has said the central government has wide powers, so why leave it to vaccine manufacturers to fix different prices as far as the vaccines that they produce are concerned? The Apex Court has asked how this is in fact possible. The government and private hospitals have, of course, been purchasing vaccines at different prices. The top court has also questioned why the centre has excluded the 18 to 44 age group from its vaccination plan. It said that people from this age group are the most active working class, and a lot of them have in fact died during the second wave. The court has also asked on what basis has the central government excluded those below 45 as part of its vaccination strategy. Further, the Supreme Court has slammed the centre for mandatory COVID registration and asked how will people in rural areas, those who are vulnerable, go online and seek a vaccine appointment. Mincing no words, the court has said the government needs to wake up and smell the coffee. Now, amend policies to address this digital divide was one of the key observations made by the Supreme Court. Next, the Supreme Court has also expressed its dissatisfaction over the centre's submission of an affidavit on the vaccine policy. The court has demanded that give us a policy document so we know what the intent of the government is and not simply an affidavit. Now, this is something that the centre will need to respond to. So the larger questions are, is it feasible to vaccinate all eligible adults before the end of the year? Well, let's take a look at the government's procurement plan. This is something that officially the Niti Aayog has put out in public domain. Serum and Bharat Biotech need to ramp up production from the current levels, but that is just about 60% of the vaccine stock budgeted by the government. Look at this. Covishield, that is Serum Institute, between August to December, they are expected to deliver 75 crore rupees. This is the government's estimate. Covaxin, which is Bharat Biotech, 55 crores between August to December. Again, that is the government's estimate. BioE has been projected as putting down as part of the vaccine supply 30 crore vaccines between August to December. But remember, this is still at the trial stage. Sputnik at this point in time only imports 15.6 crore doses have been budgeted as part of the government's plan. Let's talk about Zydus Cadila, 5 crore, currently under phase 3 trials. Serum Institute and Novavax, 20 crore has been budgeted by the government. The trials have been delayed globally as well. There is no regulatory approval that's come in for Novavax. Remember, that is being licensed here to Serum Institute. Genoa's mRNA, 6 crore. The trial continues for that particular vaccine candidate. And the Bharat Biotech nasal vaccine, 10 crore budgeted. It continues to be at trial stage. This is how the government has arrived at this 216.6 crore vaccine dose number by December, and that is the basis for making the promise that all eligible Indians will be vaccinated by the end of the year. But as we pointed out, there are questions that remain unanswered there. Joining me now to take the discussion forward, Dr. N.K. Arora, the Head of Operations Research at the National COVID-19 Task Force. Dr. Arora is also an advisor to the AEFI National Committee. We also have with us Professor Y.K. Gupta, President of AIIMS Bhopal, and Jammu. Professor Gupta is also a member of the National Expert Group on Vaccine Administration for COVID-19. Dr. Gupta and Dr. Arora, many thanks for joining us here on the program. Dr. Arora, if I may ask you, sir, you were here with me on my program on the 14th of May, where you made two very important comments. You said, A, that at least till July, August, the vaccine deficiency that we're currently seeing is likely to continue, and you expect that to start to ease up post-August. The second comment that you had made, which was equally important, was that the NTAGI was not in favor of opening up vaccine for the 18 to 44 age group because of supply constraints, because of the supply challenges. Now, given the fact that you've got a Union Cabinet Minister saying that all eligible Indian adults will be vaccinated by December, a statement that has now been made to the Supreme Court this morning by the Solicitor General, how realistic is this?
So there are two or three things we need to understand. I'll take the second question first, that India did the prioritization exercise last September, October 2020. And based on the projections of vaccine availability to the highest fertility group and also those who are likely to have severe disease and hospitalization. That means those who are likely to put maximum pressure on the health system. And it was at that time 50 years plus was considered as a priority group, along with three other groups which are at high risk of exposure to the virus. That is health providers, to services and police personnel, and the third was municipal employees. This together comprised of about 30 crore population, and that is about 2 to 2.5% population. And this is the population which it was last year throughout the first wave, contributed to 80% of the total mortality. Second, it contributed to almost 90% of the hospitalization. If I look the data today for the second wave, the proportions remain exactly the same. Unfortunately, because of the very large number of cases occurring over a short period, young people and to some extent children have become more visible, but the proportion of deaths and hospitalization is still the same proportion remains with 45 years plus, because all comorbidities are concentrated in that population. So that is answer to your second, that in the initial phase till July or so, the central government had proposed and still is continuing with that philosophy that we should have maximum immunization in this population. Thereafter, that it is to be opened up for all the age groups, including, as we are all aware, that a pediatric trial is going on. In fact, there are 2 or 3 where Cadila Zydus is also looking at trying the vaccine for 12 to 16 years, and Bharat Biotech is trying the vaccine for 2 years to 18 years. So with this in the background and the volume you have just mentioned, we should be able to immunize almost the whole population, the adult population, with vaccine. So we have about 65 crores, 60 or 65 crores in 18 to 45 population, and about 35 crores between 45 plus population. That makes about 100 crores. And less than 18 is around the remaining 30 or 35 crores. So we are in very comfortable position, and I completely agree with what the government has said. And you have looked at the letter yesterday, and even today what you showed us. Our primary suppliers will be 2 companies, Bharat Biotech and Serum Institute. And if you add up this thing, it is about 130 crores over 5 or 6 months. So approximately 20 to 25 crore doses will be available from these 2 companies. Plus, there will be others which will be contributing. Overall, we would be having at an average 30 crore doses per month, or in other words, we are ready to immunize 1 crore population every day for next 6 months, starting from second half of July or so. But prior to that, we should have sufficient vaccine to the primary saturation should be 45 year plus, because they put maximum pressure on health system.
Okay, so, again, several important things that you're saying, but you believe that we should be in a comfortable position by December on the back of the capacity that Serum Institute and Bharat Biotech are expected to add, and you're hoping that we do 1 crore inoculations per day. But we're nowhere close to that, Dr. Arora. On an average last week, for instance, we were doing only about 20 lakh a day. So from 20 lakh to 1 crore a day, how do we bridge that gap, bridge that distance?
So, in fact, that is absolutely relevant and very important question. Now, I will take you a little back about 6 weeks ago. In first 2 or 3 weeks of April, we were immunizing, maximum was I think about 4 million or 4.5 million doses a day. And if you have seen the COVID platform, 75,000 immunization centers were there. So at an average, 100 is very easy, 150 very comfortably, individuals can be immunized every day at each immunization center. India has a capacity of having at about 100,000 immunization centers, and that is the basis. So where is the bottleneck? So I would not go into the past because there have been vaccine shortage. We are aware. Still the focus is on 45 plus, and they are being given vaccine across. But 18 to 45, the vaccines are not easily available. But thereafter, the major bottleneck or major rate limiting factor I see would be the community coming up. At this time, there is very severe fear among everybody. So all of us are keen to get the vaccine. I hope the same keenness through the end of the year, because we should be able to have, without any crowding of the immunization centers, easily 100 to 150 persons per immunization center. Even if it is 75,000, which this country has shown, we should be able to immunize 7.5 million to 8 million or 9 million very easily. So the capacity to administer is not an issue. The full issue would be whether people come forward and get the vaccine, and for which all of you, the media has a very big role to see that vaccines are promoted aggressively and that the vaccines are necessary if we don't want to enter into the third phase.
Dr. Arora, since you talked about the fact that capacity to deliver the vaccine is not an issue, vaccine supply hopefully will start to ease out starting August onwards. You brought up the issue of vaccine hesitancy, and you said that the media has to play a role to encourage people to go out there and get vaccinated. But I ask you this as a member of the NTAGI, as well as a member of the National COVID Task Force. What do you make of statements coming in from somebody like Baba Ramdev, who's virtually on every mainstream media channel today talking about how vaccines are not effective, how he's not going to take a vaccine? Is this not something that the National COVID Task Force or the NTAGI will take up with the government?
So these kind of statements have been coming right from January onwards. You are all aware, and all of us are very aware that these are not isolated statements. These are coming from various quarters. And all of us have to really work out and to see that there is demystification and what do you call? We need to explode this myth that vaccines should be taken or not taken. Vaccine is one of the key pillars so that we decelerate the transmission process. We have an immunity level where then we can start living normal lives. And I must tell you, the government of India, there is a whole communication division which is working. Communication committee has been formed and which is aggressively pursuing, just like polio campaign, so that this time the task is much bigger, because adults have never been immunized. I'm sure you are aware, 2 days ago, government, in fact, I've been part of that process. It is called near home corona vaccine centers. So even in remote villages, cluster of villages, or in rural areas and urban areas and urban slums, vaccine centers will be set up so that more than 60 and fragile people or those who have physical problems, they can be immunized right near their homes. So there is a lot of effort and in practically delivering the vaccines at the home of these vulnerable people. I mean, those who are more than 60 particularly, and those having physical. So there is an all-out effort, and I hope that we should be in that direction. But a lot of learning has come from polio program so that we are able to reach maximum population. You know that in polio, we have been able to reach almost 99% of children below 5 years. I hope we are able to use that experience this time with plenty of vaccines available with us.
since you spoke about learnings, Dr. Arora, and you spoke about learnings particularly from the Pulse Polio program, let me ask you what we've heard from the Supreme Court today. One of the issues that the Supreme Court is highlighting is the digital divide and whether this business of a mandatory registration on the COVID app is going to leave large parts of the rural population unable to access the vaccine. Now, again, as a member of the COVID task force and NTAGI, is this something that you are reviewing at this point in time? How do you make sure that the vaccine is accessible to rural India?
COVID platform is a dream come true. And we must realize that it is not digital divide. It is mainstreaming everybody. The reason is that it works offline also. Now just imagine we have few program errors where person has been given one vaccine as first dose and the second vaccine as the second dose. Now this is kind of, if there was no digital platform, there would have been chaos. And we know that in coming years, we may have up to 6 or 7 or 8 vaccines simultaneously being given. And if we don't have, and then adults, there is another major issue that you cannot, if I have given you one vaccine and I have no record of sorts, how do I follow you up? It looks simpler. Actually, because of this digital platform, we are now exactly know who are the people who have taken 2 doses, who have taken 1 dose. And going into now everybody is allowed to walk into a center, get yourself vaccine, put up all your papers, and the registration process is done by the person at that immunization center. So I must also say this is a major effort to strengthen our health system. Today it is helping in COVID vaccination program, but tomorrow all our health program delivery systems will benefit with similar kind of approach. So this is not a digital divide. It is mainstreaming everybody, all vulnerable population, because the program works online and offline both. It is not necessary.
But sir, that's not happening on the ground, Dr. Arora.
Responsibility.
Dr. Arora, but that's really not happening on the ground.
No, responsibility. See, this has been given that in rural areas or urban slums where if somebody comes just walk in and if there is no internet, even then it is the responsibility of the person to enter all the details. So over the time, I must tell you, as the vaccine availability becomes okay, the number of centers are more, you may get an appointment next day. And we know that in the beginning, January and February, there was no waiting list. So similarly, now you can walk up as we move further and people can get themselves vaccinated as well as registered the time they go into. So they don't have to do it. Somebody at the immunization center will do it. But I very strongly feel it is a dream come true for all of us because it is the way forward in terms of improving the delivery and getting everybody on board for other programs also. Otherwise, very difficult. Children, I see as a pediatrician, I think it is great because I will be able to know who has got vitamin A, who has got iron deficiency, pregnant women, have they been coming? All these things can be brought onto this kind of a platform. Registration has to take place on the spot. It is not necessary that every time I do a prior appointment.
Okay. Okay. Dr. Arora, I want to ask you 2 quick questions. One, you talked about that error that we saw that took place in UP where 2 vaccines were mixed, a dose of Covishield and a dose of Covaxin. The government, by the way, Dr. Paul came out and said that, look, this is not a matter of concern, even though there is no trial that has been done so far to either comment on efficacy of mixing the 2 vaccines or safety of mixing the 2 vaccines. Is a trial likely to be taken forward anytime soon? Where do things currently stand on assessing the possibility of mixing Covishield and Covaxin? Is that on the cards?
So this whole process is called interchangeability. So first of all, I would like to assure all our viewers that this is a program error. It should have been occurring, but there is no safety concern, and these individuals are being followed up. The second is very well-designed studies are required. These are not simple studies because I need to look at, first of all, safety of this interchangeability. Second, I have to look at the immunization capacity, whether it is improving or it is reducing the ultimate immune effect or protective effect of the vaccine. And third is how much flexibility it provides through the program. So all the three things, so well-designed studies are being talked about. I'm sure all of us very soon hear more about it. And it is just not Covaxin and Covishield. We are going to have Sputnik, we are going to have Catalyziders, we are going to have Genova, we might have Pfizer, we may have Novavax, we may have Biological E. So a lot of vaccines, but you don't make a curry out of it, that all of them can be mixed and given. No, only one vaccine as a single dose is given, and subsequently another dose is to be given. Because many people got this, that we can mix up all vaccines and give it. That's not correct.
Yes, but is there a trial that is being commissioned, sir, at least for the two vaccines that are currently available and form a bulk of the vaccine program?
You will be hearing very soon about that.
Okay, you won't say any more. I want to then ask you about another report. Sorry, you were saying?
I think it is being planned, because these studies have to be very carefully planned, and it has to be embedded in the program. Third, the ethics clearances have to be taken in. So this is not that one can these are proper scientific studies.
Yeah, I would hope so. Let me ask you about other reports that are coming in suggesting that the government is now looking at the possibility of only a single dose of Covishield. Now, we've just gone through this process of enhancing the dosing interval of Covishield to 12 to 16 weeks from the 8 weeks earlier. Is the government now considering the possibility of only a single dose of Covishield, and what is the basis for exploring that? Because the latest data that's come in from the UK, since the decision on changing the dosing interval was based on data that came in from UK, the Public Health England data seems to suggest that the efficacy of a single dose of the AstraZeneca vaccine is not particularly great on the new variant, which is the dominant variant here today.
So there are studies which are being thought about where the interval between doses of, today it is Covishield, it can be Covaxin, it will be the other Catalyziders and others. So again, these will be built in within the program so that we find most appropriate doses in program, dose interval among program. So I think media has just picked up this single dose of Covishield. That is not correct. It may be single dose, it may be a dose followed by a booster. So basically intervals have to be seen, and what is the most appropriate interval. The various programs are also analyzing what is happening currently, because there are a lot of people who have received just single dose of both either Covaxin or Covishield. Others are who have received 2 doses. And then there are people who have a long interval after receiving either both of the doses. So there are all kinds of mixes of beneficiaries are available, and we are trying to see what is the impact of that. So there are, from multiple aspects, ultimately we have to find most appropriate vaccine interval for our population, because objective is it remains safe and it provides maximum protection in the context of whatever variants are circulating in the country. And here I would like to say different vaccines operate differently, particularly adenovirus-based vaccines, because the baseline adenovirus circulation makes the difference in terms of its responses.
No, so I'm asking you then, Dr. Arora, on the back of at least the data that's come in from Public Health England's latest report on the efficacy of both Pfizer-BioNTech as well as AstraZeneca against the B.1.712 variant, what is the thinking here? How are you looking at that data? Or are you working with real-time data that the country itself is generating on a daily basis to review what the dosing interval should be? Are we looking at an even longer dosing interval now for Covishield particularly? And is there any possibility of enhancing the dosing interval for even Covaxin?
So both the things are being looked at from a totally Indian real-time program data, and which will be most valid and relevant for us. And particularly when we have passed through this, the tsunami, and still there is those viruses are still circulating. So we are looking at that data, and I'm sure, and that to help us take and refinements as and when required.
So, when we last spoke, you said that this is a matter that is going to be reviewed. Can you take me through what we should expect now in terms of the periodicity of the review? We've just changed to 12 to 16 weeks for Covishield. We haven't changed for Covaxin. When is the next review? I mean, can these things be sort of transparently be made available for public consumption as well on how these decisions are being taken, when they're likely to be taken?
So, and we are dealing with a very dynamic situation. And if you recall, before 16th of January, we had one meeting where we decided to have 4 weeks for both the doses, for both the vaccines. 6 weeks later, we reviewed, we increased the dose of Covishield to 6 to 8 without touching Covishield. Covishield was still under trial mode. Now in May, we have reviewed the data again. This time again, we reviewed Public Health England's field data, where they have seen that a single dose is working for 65 to 88% single dose, and the interval was 3 months. Now, this report which has come up is on a very small sample size, just around 200 or so. And the way 1 dose, 2 dose things, they are also uncertain. They have decided to decrease the dose, the interval only for 50 years plus. So there are too many nuances. I hope all of us do understand that we have looked at the issue in its entirety, and we would take the decision in the best interest of our people and our context. And that is what will be done and is being done and was done. And in the coming months, when we are going to review, as we keep on looking the data, I'm sure you have heard about setting up a vaccine tracking system, and which will help us to look at the data at a much more frequent periodicity. And as and when required, we will be coming back with any change if required.
All right, Dr. Arora, we'll leave it there. Appreciate you joining us here on CNBC TV 18. As you point out, you feel confident that post-August we should see an easing as far as vaccine supply is concerned, especially in the 18 to 44 age group. You're also saying that we need to be very mindful and careful of not creating a curry out of mixing various vaccines, and it has to be done on a scientific basis. And of course, a review of the dosing intervals is going to happen periodically. Perhaps there could be a review soon, but we don't know. But thanks very much for joining us here on CNBC TV 18. Appreciate your time. We will take a break. There's a lot more coming up. Don't go anywhere. We're back in a moment.